If the V word for 9-1 DIVOC is so great, why are there so many healthcare frontline workers and Black people who don't want to take it? Find out the details here today on Jimmy Rants. JimmyRants.com is the website. And as always, you can engage live in the content. Come follow me. I'm right here on Instagram. We have basically a place for you to go on Instagram at Jimmy Rants. It's easy to follow. Go follow me over there. Austin follows me. She just popped in. So go follow me over there. We do go live Monday through Friday, 11 a.m. Eastern Time. Thank you so much for being here today. We also simulcast live over here on Twitch, where I see Grizz just said hello. Hello to you. Thanks for watching today on the Twitch feed. Also on Facebook, where we got Linda and Cindy just popped in along with everyone else who was already here. And then finally over here on my YouTube channel, where Shirley is one of my regulars over there, and she says hello as well as Ann. Good morning, good morning. Thank you guys for being here today on Jimmy Rants. If you missed the live though, you can watch it on the replay right here on Instagram at the Jimmy Rants page. I put it right up on IGTV just as soon as this is over. The replay is actually also available over on Twitch. So if you don't have the Twitch app, download it. It's pretty easy to download. It's available wherever you get your apps. And then just follow the account Jimmy More Rants, and you can follow me over on Twitch. Hello, Prague Queen over on Twitch. See, I knew putting it on my stories on Instagram was going to be a good idea, a little swipe up thing for people to just pop right into Twitch. So thank you guys for being here today. You can also watch the replay up over on YouTube. Type in a keyword Jimmy Rants. You will find the show. I will let you know the brand new episode of the One Step Deeper podcast that I do with my friend Brittany. We posted or did a live premiere last night of the One Step Deeper podcast. We talked all about the Enneagram personality test. And so it's now available for you to watch over on YouTube as well. If you type in a keyword One Step Deeper podcast, you will definitely find the show. And episode 6, we talked all about the Enneagram. And then finally, you can find all the episodes of Jimmy Rants over at the official website. It is JimmyRants.com. And no matter what happens with all the censorship going on in the world these days, we will always have those episodes for you over at JimmyRants.com. Okay, you guys, hello. Welcome to a brand new week of Jimmy Rants. Hope you had a wonderful holiday weekend, and now it's back to life, back to reality. So many people went away, and now they're back, and they're just like, it's Monday. I've never looked at Monday that way. I'm pretty happy-go-lucky anyway, and so I don't see Mondays as a bad thing. I get to be here on Jimmy Rants with you guys. So before we get to today's topic, I want to kind of give you an outline of everything we're doing this week. I post this every week on Mondays, by the way, on my social media page, especially here on Instagram, of what I'm going to be talking about. But also on the Monday show, I tell you those things as well. So today we're going to talk about the 9-1 DIVOC V word. So sometimes I'll throw that out there in written form, and people are like, what the heck is a 9-1 DIVOC? I'm like, look at it backwards. Now read it backward. Oh, okay, now we know what it is. And then V word is self-evident. So we're going to talk about the 9-1 DIVOC V word and some very interesting statistics about healthcare workers refusing to take it. I know it seems like every healthcare worker is getting it right now. You're going to find out an interesting statistic that will shock you here in a moment. And then the Black community. Huge resistance to this, and we've got lots of stories to talk about why here in just a moment. Tomorrow on Jimmy Rants, on the Tuesday episode, I've got a new article from my friend right here on Instagram. She goes by Doctoring Keto. Her name, Dr. Kristen Bear, MD, and she has a wonderful article about the role that your metabolism and your health actually works with this 9-1 DIVOC, so that's going to be interesting. Then on Wednesday, I've got an article about scientifically proven habits to help you beat procrastination and tackle your to-do list. So that will be a fun one to do, as well as my cat over there is playing with something on the ground. What are you playing with? So if you hear noise in the background, it's just my cat Skunk playing with something on the ground. Then on Thursday, we have a new study. You guys know how I like to nerd out on the studies, and we will definitely break down this study all about later eating and sleep timing can be a predictor of why you have higher body fat percentage. And so really nice paper there that I will go over. Are you going to drive me crazy? Oh, she's playing with my cord. Hang on a second while I knock the snot out of this thing. Get out of there. No. She was chewing on the end of one of my charger cords for my little lithium battery charger. She was chewing on the end of the cord. Like, one of two things is going to happen. She's going to chew it off, or she's going to die. Yes, very bad Skunk. Thank you. Okay, guys, enough of real world stuff. Skunk, bad girl. Skunk. Going to show her on camera, but now she's going to be camera shy. All right, let's get to today's show. So you guys know there is a huge operation going on right now, and I've been talking about it quite often here on Jimmy Rants, of trying to get everybody to take this V word for 9-1 DIVOC. And we have seen lots of prominent TV kind of appearances by different people getting the shot, and then, oh, it's awesome, oh, the pandemic's coming to an end, and this whole psyop that they're giving us right now, making it appear that everybody is excited about and getting the V word, okay? So, what if it's not true? Have you stopped to think about that? What if all the heavy promotion is designed to make you think that this is what's happening? And of course, some people are like, well, it's definitely a positive direction, and the V word's the way out of this pandemic, and da-da-da. And I just kind of question that. And not questioning it just because I'm trying to be spiteful, truly questioning that narrative that this V word is going to be the grand answer to ending 9-1 DIVOC as a pandemic. So I found a few articles over the weekend that I think you will find very interesting. And we're going to start with the healthcare workers, because it looks like, according to this Forbes magazine article, that there are a large number of healthcare workers and frontline workers. These are people that have been treating 9-1 DIVOC patients, and in nursing homes and all of kind of the healthcare industry. They are just flat out refusing to take the 9-1 DIVOC V word. Now, other than this Forbes magazine article, I haven't seen a whole lot of attention being brought to this issue, which makes you wonder why. Like, I can appreciate that they want to show that people are kidding the V word. Fine, do that, whatever. But show the other side of it, that there are concerns. And see, I hear from them every single day, but there are nurses and PAs and medical doctors that are scared half to death that this is going to be forced on them, and they don't want to take it. And they're going to come to a point where they have to either agree to take it, or they don't have a job anymore. And so a lot of them are in that moral dilemma of, should I take it, should I not take it? And this article kind of underscores this. So despite the 9-1 DIVOC death count in the United States rapidly accelerating, according to the Forbes article, it's not rapidly accelerating. I mean, the psyop they're doing on making it seem like everybody's falling over dead from 9-1 DIVOC is just disgusting. And I think people are tired of this whole crying wolf thing. Because when you cry wolf enough, people don't believe it anymore. And that's where we are with this. There is a startling high percentage of healthcare professionals and frontline workers throughout the country who have been prioritized as the early recipients of the V word. They are now reportedly hesitant, or they are outright refusing to take it. And again, they're commentating here. Despite clear scientific evidence that the V words are safe and effective. Look, you can tell me that shit is totally safe and effective for me to be eating. Am I gonna eat it? No. Why? Because I know it's shit. And so the same thing with this 9-1 DIVOC V word. Somebody got on one of my posts today, I think it was on Instagram, and she's like, well, we have chicken pox and measles things, and nothing's wrong, and why is this one any different? And this one's very different. It was rushed. It's got PEG in it, which I've talked about extensively on previous Jimmy Rants, which is causing a lot of these reactions people are having, the autoimmune, Bell's palsy. I could go down the list of all the things, the anaphylactic shock, people dying. You're not hearing a lot about that as well. So all of those things are things to hit the brakes on. This 9-1 DIVOC V word is also the very first V word that's what's called an mRNA, messenger RNA V word. We've never had these on humans ever in the history of man, ever. And now they're putting it on tens of millions of people here in America. And the problem is they've never been tested on humans. And in every animal trial, the reason they ended the trial as much as a decade ago, every animal trial, the animals got very, very sick. And some of them died. Which is why when they skipped the animal trials in the clinical trials of these V words, and then they hurriedly went through phase 2, and then they got to phase 3 and only tested healthy people, not a wide variety of people like they're supposed to, you can see why there is such hesitation, not just in the medical health community, but with everybody. So Ohio Governor Mike DeWine said that he is troubled by the low numbers of nursing home workers who have said they do not want to take the 9-1 DIVOC V word. He said approximately 6 out of 10 nursing home staff have said, nope, not taking it, don't want it. Isn't that interesting? And so nursing home, like you would think, okay, oh my gosh, those patients, if they get 9-1 DIVOC, they're dead as a doorknob because they're in that category of people that would certainly be more highly susceptible to the ramifications of 9-1 DIVOC than others. 60% of them said, I ain't taking it. The workers. I ain't taking it. Dr. Joseph Veron, chief of critical care at Houston's United Memorial Medical Center, he told the NPR in December that more than half of the nurses in his unit said they didn't want it either. Roughly 55% of New York Fire Department firefighters said they would not get this V word as well. Are you seeing all of these statistics, you guys? Have you heard anything about this? No, they're making it seem like everybody wants it, everybody's excited for it. But the reality of the situation is these are medical healthcare professionals, and at a rate of somewhere between 50 to 60%, they don't want to take it. Does that not concern anyone who's a layperson looking to these medical professionals? Because if they're truly getting it, then okay, maybe that would relax some people's fears. But over half of them are saying, I ain't taking it. There's no way that I would ever want that. Is that not a concern? LA Times reported on Thursday that hospital and public officials in Riverside, California have been forced to try to figure out how to best allocate all the unused doses because 50% of the frontline workers in the county just said they didn't want it. And I love that they have the ability to say no. I wonder, though, how ostracized all of these people who are anti the V word for 9-1 DIVOC, how many of these frontline workers are getting pressure that they have to take it? I just wonder. Fewer than half of the hospital workers at the St. Elizabeth Community Hospital in Tehama County, California were willing to be V-worded. Around 20 to 40% of LA County's frontline workers have reportedly declined an opportunity as well. The chief clinical officer at Chicago's Loretto Hospital, Nicola Giuvati, said that a survey was given out in December. 40% of their hospital staff said they did not want the V word. A recent survey by the Kaiser Family Foundation found that 29% of healthcare workers were hesitant about getting the V word. And here were their reasons, guys, and see if it matches up a little bit with your own reasons. There are concerns related to potential side effects. We've talked about some of those here. That ingredient, guys, if you have not looked up PEG, go look up that ingredient, polyethyl glycol. And in that ingredient, it has been known in research papers to trigger autoimmune disease, to create anaphylactic shock, which could kill you. I mean, I could go down the list of all the side effects of PEG, but I already did a Jimmy Rants on that. Go back and look at it from a few weeks ago. I did a whole episode just on that ingredient in this V word. But these healthcare professionals, they know that side effect is happening. They also have a lack of faith in the government to ensure that these are safe. And at the beginning of this article, we have clear scientific evidence that the V words are safe and effective. And I'm going, no, we don't. We don't have clear anything. Frontline workers in the United States are disproportionately, listen to this, Black and Hispanic. The pandemic has taken an outsized toll on this segment of the population, which has reportedly accounted for 65% of the fatalities in cases in which there is race and ethnicity data. 2/3 of them are from the Black and Hispanic community. So these healthcare workers on the front lines who are Black and Hispanic, who know these statistics, they're very concerned. Why would they want to inject themselves with this thing, knowing the side effects and knowing that there's a lack of faith in the government to ensure that this is safe? There was a study published by the journal The Lancet over the summer, found that healthcare workers of color were more than twice as likely as their white counterparts to test positive for 9-1 DIVOC. According to a Pew Research Center poll published in December, V-word skepticism is highest among Black Americans, which we will talk about in some articles here in a minute, as less than 43% say that they would definitely or probably get a 9-1 DIVOC V-word. Dr. Giuvati told NPR that there's no transparency between the pharmaceutical companies or the research companies or the government sometimes on how many people from Black and Latino communities were involved in the research of the V-word. I can tell you that. Not many. Not many. Because of the 40,000 that was in the Pfizer trial and the Moderna trial, of that many, they only used about 150 to 170 people in the final results of, these people did fine. How many of those people were people of color? Very few. And so you can understand, and again, these are healthcare workers who know the stats. And there's something deeper than just the stats in the health community we're going to talk about here in a second regarding people of color, but this is big, you guys. Dr. Varon said that the fact that the Trump administration is in charge of accelerating this process also bothers some individuals who refuse to get the V word, adding that they all think it's meant to harm specific people in the population. Now, you can take of that what you want, but there is that concern, that perception by people. In an op-ed published in the New York Times last week, emergency physicians Benjamin Thomas and Monique Smith wrote that V-word reluctance is a direct consequence of the medical system's routine mistreatment of Black people and the past atrocities, which again, we'll get into more here in just a moment. All of these things exemplify the culture of medical exploitation, abuse, and the neglect of Black Americans. So one of those things is the Tuskegee syphilis study, which I've told you about before. And again, we're going to get into here in a minute. There's also the unethical surgeries that were performed by J. Marion Simmons. And even a black physician, a medical doctor, this lady got 9-1 DIVOC recently. I don't know if you saw the video of her, but she was in her hospital bed and she was not getting properly treated for 9-1 DIVOC. And she was even telling them what she needed. I need this, I need that. They wouldn't give her pain medication to help. They wouldn't give her any help. And she was asking to be transferred out of that hospital to another one. They sent her home and she wasn't well. And she passed away 3 days later. It's just a tragedy what's happening. And this happens more than we know, which is why I wanted to highlight it here on Jimmy Rants today. Dr. Fauci, who we know who that is, said in an interview last Friday that it's quite possible the 9-1 DIVOC V word could be required if you wanted to travel internationally and to attend school at some point in the future. But 40 million in early December, government officials said they plan to have that number of doses available by the end of 2020, which would be enough to V-word 20 million people. However, according to the CDC, less than 3 million got the first dose, with 14 million doses distributed. So there's a bunch of doses out there, but I wonder if their reason why they haven't been able to V-word as many people is there is this resistance to it. Now, healthcare workers is one thing, but let's talk about specifically people of color and the black community. Because I got attention to one of the people I follow here on Instagram. I saw this over the weekend. I had to print it out, and then I had to do this Jimmy Rants here today. Dr. Asia Muhammad. So there she is. Go follow her over on Instagram, Dr. Asia Muhammad. She is a huge rights of black people kind of author. She's also into the health and wellness world. And she had this to say on like Saturday or Sunday. I forget when I printed this. But she had this to say regarding this V word. And listen to this carefully. It is both racist and extremely privileged for any person who has a degree or otherwise to attempt to influence and encourage black people to receive a shot. Black people just don't trust the medical system in America. History tells us we simply cannot trust you, period. If you have a medical opinion, it was afforded to you by black bodies, and your ignorance to this fact is proof of your privilege. Remember this when you're espousing your privilege boldly. It must be so nice to live in a world where you can trust your government and medical societies because they've never done any wrong to you or because you've benefited from them. What we are facing now is the direct cause of the mistreatment of people for centuries. Come argue with your mama. That's awesome. And I find it very fascinating that some of the alliances regarding the politicization of this V word is where there's a lot of people that say, well, this came from ex-president and I'm against ex-president, so therefore I'm against this V word. But now that there seems to be this transition to a new president of the opposite party, now there's more inclusiveness of that message. It's really fascinating, kind of the cross-culturalism of this entire discussion regarding the V word. And I love how passionate she was because she's so right. And just before I came on the air about an hour ago, this lady brought this to my attention from Canada. This was in the Toronto Star, bringing a 9-1 DIVOC V word to black and indigenous communities distrustful of the health system has very unique challenges, and here are some places to start. So they're recognizing that there are challenges in reaching that community of people, and they try to offer up some suggestions. So back in 2013, the flu V word rate among clients at the community health center with a lot of Black and Indigenous people was stubbornly stuck at around 10%. That's how reticent they were to taking this, well below the average. Staff at the center, which serves the Black community as its primary population, wanted to figure out why so many of them were reluctant to take the V word. So they conducted a survey and had clients describe their concerns, which ranged from fears that they could contract the flu from the V word, which is a very real and present danger. A lot of people who take the flu V word, the seasonal flu V word, regularly get the flu. I've never, ever in my life gotten the flu V word. And I've never, ever in my life gotten the flu. They also worry about side effects. The following year, the health center, listen to this, used the information from the survey to target educate before the V word rollout. The V word rate increased from 10% to 16% in the first year, and it's steadily risen. It now stands at 53%, which is higher than the national average. It was such a huge jump, according to the executive director. The campaign worked, he said, because they listened to their clients, addressed the concerns, and more importantly, their clients trusted them. Our communities have a huge trust issue with healthcare. I want to know, how did they get them to trust them? And did they have to lie or distort or propagandize in order for that to happen? If they did, shame on them. Shame on them. With Canada embarking on the largest and most important immunization campaign in the country's history, talking about the 9-1 DIVOC V word, they are looking to the leaders of this group, and they say public health agencies should take advantage of that trust that they have built within their communities, which may be more skeptical of this V word due to a mistrust of the healthcare system, historically mistreated them. Engagement is the key. There is significant V word hesitancy within the general population there in Canada. A recent survey by polling firm Angus Reid found 48% of Canadians said that they would get the 9-1 DIVOC as soon as it was available. So just under half. 31% said, yeah, I'll get it eventually. 14% would not get it, and then 7% weren't sure. Experts say whatever the hesitancy exists in the general population is compounded when you add in the race and indigenous population by systemic racism, historical injustices, and negative personal experiences with the healthcare system. And I don't think it's limited, this negative healthcare system kind of engagement. I don't think it's just limited to the Black community. I think anybody that has had a bad experience is going to have trouble with this V word. There's very much a mistrust in our systems for people of African descent, according to a professor of race and health. In the U.S., surveys have found that Black and Latino people in particular have less trust in the safety and efficacy of the 9-1 DIVOC V word. There isn't robust race-based data on V word hesitancy in Canada, but they say qualitative research suggests there is lower trust in the Black community in Canada as well. So medical and scientific research has been historically controlled by white men and largely has excluded Black people. When they were included, it was often without their consent. So we've talked about this before. The Tuskegee syphilis study was conducted by the U.S. Public Health Service from 1932 to 1972, and it studied the effects of untreated syphilis on Black men. And they didn't tell them, you guys. They lied. They kept that information from them. Pfizer and Moderna, the makers of the two 9-1 DIVOC V words currently on the market, have both published the demographic data for their clinical trials, which included, they claim, 42% and 37% people of color. Both companies said they strove to include communities that have been historically underrepresented and disproportionately affected by 9-1 DIVOC. But they're in the study, but they're only in the pool of people, that 30 to 40,000 we were talking about. When you look at that 150 to 170 people that ended up in the trial itself, where are the black people? Where are the Hispanic people? They weren't there, guys. Indigenous people likewise also have a good reason to distrust government health care. For decades, the federal government operated so-called Indian hospitals, racially segregated and poorly resourced health facilities where V-word experiments were sometimes conducted on these people without their knowledge. In the 1940s, government scientists also did nutrition experiments on indigenous people without consent. Yeah, they did a lot of starvation type of studies back in the 40s. Just flat out starved them for days and days and days and days and days. Just see what would happen. They were the guinea pigs. The injustices are not only historical. In September, the death of 37-year-old Joyce Etchquan from one of these indigenous tribes garnered national attention when, before her death at a Joliet hospital, she was live streaming a video showing nurses actively insulting her. So, of course, there definitely will be some medical distrust. They would be wise to utilize the capacity of indigenous healthcare providers to deliver this V word for 9-1 DIVOC. If you engage with them effectively and appropriately, there are real ways that you can get better uptake and engagement with the population. The province says it's working on a 9-1 DIVOC immunization program, but so far has been short on specifics aside from the initial rollout. So they were forming a 9-member 9-1 DIVOC V-word distribution task force. And on the 9 members, they had 3 people of color. Looks like a couple from the indigenous tribes and 1 black person. The province would not make any member of the task force available for an interview, so we don't know what they think. In terms of what the province is doing to build trust for the V-word within the black community, as well as the indigenous people, a health ministry spokesperson only addressed the indigenous part, saying that dedicated engagement is essential in order to deliver an effective and culturally appropriate approach to the V-word. All right, let's see if there's anything else in here about that, because there's some great data in these other articles I did. All right, so they're underscoring a lot of the reason why they're putting such focus on the black community is they're the ones that have been most affected by 9-1 DIVOC. The skepticism towards a V word among black people is a healthy response to history. Yeah, like, know your history. I am shocked how many people have never heard of the Tuskegee syphilis trials. Like, really? Know your history. And I think in the black community, they've had it hammered in them. Oh, don't trust them doctors. Don't trust those people because they've hurt our people in the past. And that gets passed around. If you know history, then this is not a surprise. That's why they're mistrustful. And it's not just history. It's what's actively happening right now, like what Asia was talking about in her article that she did. Look, we don't trust you. You have lied to us before. You have hurt us before. There ain't no way, no how. We want your shot. Come at your mama. She knows, because she knows history. And they, I guess, hope that people don't know their history. All right, so let's get to the next article. Of course, black Americans are wary of the 9-1 DIVOC V word, and here is a path forward. All right, let me skip around because I've already given a lot of this kind of background data, but I want to get to the good part. From the very beginning of this pandemic, we've witnessed the glaring intersection of racial and social inequity in healthcare. We saw policies that could lead to the unequal distribution of dwindling hospital resources amongst black patients. We heard from people who reported that medical professionals discounted their symptoms. This summer, there was fear that medical personnel might refuse treatment if you protested during a Black Lives Matter protest. The phenomenon of medical racism has been amplified in this era of 9-1 DIVOC, but it is by no means Black America's first introduction. Ask any black person in America of any age to quantify what their distrust is in Western medicine or the United States government, they will immediately cite multiple infamous racial injustices. So there's this idea of medical racism, not just a talking point of the historical injustices of people of color. It is the bedside warnings from our mothers before we go to the doctor. Can you imagine? Like we talked a lot earlier in the last year when all the race riots and everything was going on about police brutality and being concerned that they had to have this talk with their black kids. Okay, yes sir, no sir, keep your hands out in the open and don't do anything. And it's the same with going to the doctor. Like, did you know that? Did you know black parents have to talk to their kids? Okay, you're going to go see a doctor and here's some concerns and let us know and da-da-da. That's scary. It's the tale of the elders regaled amongst almost like ghost stories in their believability that such cruelty could be inflicted upon people. My own biological mother, who gave me up for adoption at birth, was only given Tylenol for what was diagnosed later as stage 4 colon cancer. She was given less than a year to live. Between the 1900s and 1970s, thousands of black women and other women of color were sterilized without their consent, sometimes without their knowledge because of forced sterilization authorizations that existed in over 30 states. In North Carolina, there was this involuntary eugenics. Eugenics is this whole idea of cutting down the population, depopulating. Bill Gates is a big fan of eugenics. And there's another reason why there might be reticence to this V word by a lot of people. Bill Gates is the one pushing the V word hard. He's very openly said in talks he's given that he wants to help depopulate the earth, and he's a believer in eugenics. Planned Parenthood, the lady that created that organization, also is a big fan of eugenics, which is why she was more than happy to kill a bunch of black babies through abortion. Are you seeing the connection? The Eugenics Compensation Act of 2015 allowed approximately 220 living victims to get compensation for what happened back in North Carolina. In Washington, D.C., the theft of Henrietta Lacks' cell line by Johns Hopkins Hospital researchers revolutionized medicine, creating the immortal HeLa cells, but compromised its donor's treatment for cervical cancer. Her family was completely unaware that her biological material was being used for unethical scientific research for over 60 years, and they were never compensated. In Alabama, the Tuskegee syphilis experiment, a 4-decade study on untreated syphilis conducted on illiterate black male sharecroppers without informed consent and under the deception that they would be given free medical care, irrevocably damaged black Americans' trust in the medical community. Tuskegee, guys, that is the key. That's the one that sent it off the rails, that made the black community be incredibly distrustful of the whole system of the medical care. A research study from 1999, listen to this, found that around 80% of black men surveyed believed the men were deliberately being injected with syphilis. That is a sad story. But it's a story that lives on in their consciousness, guys. And through word of mouth in the black community, they're passing that on. Oh, we can't trust doctors. They injected our people with syphilis directly. They killed our people, so watch out. I couldn't imagine, and I never knew this growing up. I'm only learning this as an adult, and it's disgusting. These wounds will never truly heal. These sins will never be forgotten, and the hesitancy of the black community to place a profound amount of trust in these same systems now with the 9-1 DIVOC V word. You know why they're hesitant now? They haven't proven themselves trustworthy. Time and time again, they've turned their backs. Therefore, it is up to us as healthcare professionals to try to earn the public trust that this massive stride towards herd immunity against 9-1 DIVOC demands. So here's the thing. If you add up the black community and the Hispanic community, they're about a 30% chunk in our nation. Okay? So let's act like most of those people in the black and brown communities will not be taking this V word, okay? And then let's say only half of the people in the white community take this V word, which is specifically the statistics that I've seen, especially if you look at some of those healthcare workers. It's about half. We ain't nowhere close to getting to the level of V word for 9/1 DIVOC to reach herd immunity. How are they going to convince these people? It's the challenge. And I don't think they thought this through, other than they thought maybe some of their coercion tactics would work. But here we are, bunch of people, not real happy, not real excited about taking this V word, yours truly included, not gonna. So what do? Half of white people and even like 80% of black and brown people refuse to take the 9/1 DIVOC V word. That's only about 55-60% total of the population that will end up taking this thing. Then what? What do they do? Because supposedly we got to get to 80, 85, 90%, according to Dr. Fauci, to reach herd immunity, which is idiotic, by the way. We don't need 90%. Statistically, historically, 65 to 70% gets you there. But even that's going to be a challenge because people are very reticent about taking this. So the author of this article is a black epidemiologist. He says, I've often said that the difference between the fields of public health and medicine is that public health is primarily focused on prevention. Prevention efforts require not only education, but also coordinated efforts for the proper dissemination of that information. In our nation's history, when public health and medicine have come together as they are now, we have accomplished the impossible, like the elimination of measles and rubella in the early 2000s. So how do we replicate that to restore public trust? First, you bring everyone to the table, and I mean everyone. Answer all the questions, educate. Don't ask minority communities, especially ones scarred by generations of trauma at the hands of medical racism, to come to us. Go to them. That was the one thing when all this went down with the 9/1 DIVOC V word. We're going to get the healthcare workers first, and then we're going to get the sick and elderly in the nursing homes next, and then black people, we're coming for you next. Like, as soon as I heard that, I was like, oh, that's not going to go over very well. That's not going to go over well at all. Work with trusted leaders within their communities. An example of this is how in my city of New Orleans, which is predominantly black, has handled the 9/1 DIVOC pandemic this year. Once on track to become the epicenter for 9/1 DIVOC, New Orleans was able to lower both its incidence and prevalence rates by holding nightly informational sessions on local news, which included black doctors and healthcare providers, disseminating testing availability through the Department of Health, and asking local community leaders, such as the deans of the two largest historical black colleges there in the city, to explain and solicit participation in the clinical trials. When people are not only educated, but also included in the decisions about their health and safety, the community is safer. That's what community health looks like. Fortunately, we are seeing these approaches replicated on a national scale. Back in April, the world met Kizzmekia Corbett, the black viral immunologist at the V-Word Research Center at the National Institute of Allergy and Infectious Diseases. She informed us that help was on the way and that a 9/1 DIVOC V-Word was on track for December. She kept her promise. In December, the V-Word created by both Moderna and Pfizer were granted emergency use authorization. Americans watched as a black intensive care unit nurse in NYC became one of the first in the country to get it, which was administered by another black healthcare professional. See, my concern with this is it's all about the optics. Oh, black people, we have a black person to talk to you about this. Trying to build the trust. Oh, the first person to get the V word for 9/1 DIVOC is a black nurse, and there was a black person giving the needle in the black nurse's arm. That's supposed to build trust. Like, Is it all about the optics? Now, I get it. They're trying their best to ease some of those concerns, but just seems weird. Seems all marketing to me. Per the CDC, 60% of issues that lead to premature death in the U.S. are caused by social and environmental factors. Only 10% of those factors are caused by faulty clinical care. As a result, there's been concentrated efforts by public health officials and the medical community to engage and partner with these minority communities. So that's their end, you guys. They're trying their best to use these optics with people of color, having people of color educate them and show them and answer questions for them. Do you think that's going to work? Is that the answer to assuage some of those fears? I don't know. It probably will a lot of people. All right. With 49% of Black Americans polled refusing the V word, even if it is deemed safe and free, it is my sincerest hope that Black healthcare providers and epidemiologists like myself use this time to speak to the communities around us and dispel fact from fiction. We have dedicated our lives to science and the healing of our communities. Explain to your loved ones that it takes approximately 2 weeks for the body to establish immunity to a pathogen once you get the V word. Explain that you still need to practice social distancing and wear a mask. See, I don't get that. If we're getting the V word and we're supposedly no longer susceptible to getting 9-1 DIVOC, why are we still wearing a mask? Why are we still socially distanced? And that's not how they pitched it. When we get the V word, all the normality will return. Well, that ain't true. And if it's not true now, when's it gonna be true? On and on and on. So I can appreciate the efforts. And by the way, that was Gabrielle Perry, an infectious disease epidemiologist in Louisiana. And this was from refinery29.com, that article that I just read. But they're working very hard to make this appear that they're going to convince people to take this shot. And I'm going, are they? Is it working? Do you think it's going to work? Do you think people are lining up, especially in the Black community? I don't know. I got another one from Time Magazine. Fueled by a history of mistreatment, Black Americans now distrust the new 9-1 DIVOC V word. A 22-year-old named Brianna Clark, she said, I don't trust this V word. I think it's too soon to have a V word. She's right. The average amount of time, at 22 years old, she's brilliant already because she already knows. The average amount of time to create a V word is 5 to 20 years and leaning more on the back end rather than the 5 years. This one was done in about 10 months. So she's right to question how quickly it came along. She is among a significant number of Black Americans skeptical of the healthcare industry and this new V word. The rollout of the V word came mid-December. Here's where Dr. Fauci predicted that we would need herd immunity. We would need V word of 75 to 85% of the population. We're not going to get there. Not with the current reticence to taking the V word. There is a real concern that the distrust in public health officials from Black Americans could impact our ability to get herd immunity. 70% of Americans believe that people are treated unfairly based on race when they seek medical care. It's a feeling born of unequal access to care, and it's only been intensified by the pandemic. And probably feeding into this as well is the number of people who have died, and where 2/3 of the deaths are people of color. All right, so they claim that the circumstances of this pandemic made it where we had to rush this process. Why? The recovery rate under the age of 70 is over 99%. Over the age of 70, it's still over 94%. So it's not like there was this great danger that people are dropping like flies. And as I said on a previous Jimmy Rants, If the rate of death was 30%, you bet this response we're having now, highly, highly appropriate. But less than 1% for the vast majority of the population. There was no urgency here. Having a normally years-long process of developing and distributing a V-word telescoped into a matter of months, along with calling it Operation Warp Speed, did not instill confidence in very many Americans. In the V-word development trials, usually a V-word takes 15 to 20 years to develop. That's the norm. Because of how quickly the 9-1 DIVOC V-words have been developed, she points out we don't have the long-term data. Guess what? If you're one of the ones getting this stick in your arm, you are the long-term data. And that's another thing. There's a lot of people in the healthcare world. There's a lot of black people. All right, all the rest of you can be guinea pigs. And when I see that you don't grow horns out of your head, you don't develop some disease, and God forbid you don't die from this V word, then maybe. But it's going to be years down the road. We're not talking about, oh, they got the shot 2 weeks ago, the second shot's coming up soon. That's good enough. They haven't had anything weird happen. I'll go ahead and do it. No, they want to see it and see months, years pass to make sure people are okay. And we don't know the answers to that yet. At this point, it's a big question mark because they did not do the proper clinical trials on these V words. This is one of the reasons that Americans of color have been less likely to enroll in clinical trials for these V words, and others are still in development. Of the 350,000 people who registered online for a coronavirus clinical trial, just 10% are Black and Latino. That's less than a third of the total U.S. population of these two groups, which is 31.9%. The CDC data shows that more than half of the U.S. 9-1 DIVOC cases have been amongst Black and Latino people. Like many of the other trials, white participation outpaces people of color. We need to be very proactive and mindful about ensuring enough spots are allocated for people of color, so by the time trials are over, we don't see the vast majority of them going to white people. It's about ensuring that we are being transparent, providing accurate information in a timely manner, and that we as researchers, as well as scientific community, are showing that we're trustworthy. There's too much history there. How do you do that? Too much history there. All right. I'm going to skip over because we just had some of that. The Tuskegee trial, by the way, had 600 black men. 399 had syphilis. The participants were tricked into believing they were getting free health care. Instead, they were just given syphilis to see what would happen. Yeah, it was bad. They were treated for bad blood, and they never got anything for their illness, not even after penicillin was found to cure it in the mid-40s. Dozens of them died, and they didn't get exposed until 1972. Huge, egregious example of medical racism. Researchers have documented many ways patients that are black are treated differently, and we talked about that. These examples of malpractice are far from forgotten by the black community. The community has suffered incalculable damage due to ongoing reprehensible health care, which has only been made worse by 9-1 DIVOC. Okay. The president of the University of Maryland at Baltimore, Freeman Hrabowski, wants to change the attitude about the V word within the black community and save lives. Him and his wife participated in phase 3 clinical trial for Moderna. I'm from Alabama. All my life, I knew about what was done to black men, how they were abused, the awful Tuskegee experiment, so I can understand people of color questioning the motivations of people when they talk about this. But we must believe in the science. In spite of the challenge of our history and the way we've been treated, the reason I say this is, what choice do we have? Disproportionately large numbers of blacks are contracting the disease and are dying. It helps for people to know there have been people of different backgrounds, different racial backgrounds, and in the development of the V word. As of December 21st, participants in the Pfizer V word studies, 10% are Black and African American, 13% Hispanic, 4% Asian, and the rest white. That's actually relatively representative of the U.S. population, at least compared to the usual makeup of the studies. It's not perfect, but it's closer. While the medical industry insists it is moving with deliberate speed towards diversity and inclusion in these drug trials, some say prioritizing racial minorities is unlawful, and unethical. The issues with distributing the V word and who should get it first are really controversial and contentious. There has been some debate on whether we should be targeting people of color with the V word. That's interesting. Let them go last if they so choose, or not at all if they so choose. I don't know why that's hard for them to understand. With a limited number of shots, the deadly virus has turned allocation decisions into an ethical dilemma. It's not a deadly virus! Let's stop it! Let's stop with the deadly virus bullshit. We don't have extra deaths, guys. If you look the data of the number of people that died in 2020, it statistically is no different than the number that died in 2019, 2018, 2017. It's the same. We had the wool pulled over our eyes when someone got in a car accident and they happened to test positive for 9-1 DIVOC. They were a 9-1 DIVOC death. We've had gunshot wounds. Again, died. But they had 9-1 DIVOC, therefore they're a 9-1 DIVOC death. So let's stop it with this is a killer. This was not a killer. Not a killer. Not to the level that they're making it seem. All right, let's see if there's anything else in here. Okay, so there's a move to allocate the V words for the at-risk communities in the healthcare system for Black, Hispanic, and Indigenous people. But that doesn't solve the concerns. The Black community will be critical to get increased buy-in to the V word. Otherwise, we have a community that has unanswered questions and address their concerns. Creating a narrative directing decisions towards them would be great. They frequently have conversations within the Black community. Yeah, we talked about all that. All right, so what do you think about this? Like, why are Black people and healthcare workers running away from supposedly the thing that's going to bring this pandemic to an end? And does that concern you as someone who may not be a person of color, who may not be in the healthcare industry? Does that concern you that these people ain't real happy about wanting to get the stick in their arm? It does me. Now, I was already convinced it was not a good idea already, but those people who are kind of on the fence, are you watching? Are you seeing the healthcare workers? Half of them say, not going to do it. Are you watching the Black community and how reticent they are? How much they're ready to run away from this thing? It's concerning you guys, and definitely it's going to be an uphill battle if they think the V word is the way out of this pandemic. All right, let's see what you guys have to say. We're going to come here first to my Instagram page, then over to Twitch, finally over to Facebook. Looks like YouTube froze up and just died in the middle. There were a few comments that I can still see, so I will get to those here in just a moment. But let's go to Instagram first. What's up? Instagram, JimmyRants.com is the website. See what you guys have to say. Kat says, I asked everybody I could in healthcare if they're being pressured to take this 9-1 DIVOC V word. No pressure so far, but it was huge pressure with the flu V word. Up to no schedule or shifts were given until it was done. Ooh, that's bad. And I wonder, Kat, and Kat is a medical doctor, you guys. I wonder if they don't get enough participation, or if some of the patients of these medical professionals say, well, wait a minute, My doctor's not even taking this. Why should I take it? That there would be pressure applied to them at that point. I don't know. I know many people that can't wait to get their dose, and I think after all volunteers get it, they'll try to mandate it. Yeah, that's what I was just saying. I think they're waiting to see who's going to take it willingly and who are we going to have to twist their arm or bribe to get them to take it. Joshua says, as long as we're wearing masks as a precaution and not a specific purpose, we will never get rid of them. Well, that's what I'm saying. Like, if we get this V word and then we still have to wear a mask, we still have to socially distance, we still have to lock ourselves away from society, what's the point of the V word? And they're even saying that the V word won't prevent you from spreading the disease. And the V word, you'll keep needing to have booster shots, multiple ones a year. When do we ever get, quote, back to normal? It ain't happening until people realize what this is really all about. Joshua says, I live close to a native reserve and they seem to be believing everything about this pandemic. Yeah. They have check stops at every entrance and they take your name and number and your temperature before you go through. Well, maybe a little bit of that is CYA, Joshua. I don't know. All right, thank you, Instagram. Let's go over here to Twitch. We got a bunch of people on Twitch today. Thank you guys for being here and engaging. See what you have to say. Prog Queen didn't like it that I'm looking right at the Instagram feed because this is the main feed. I do the show from here, but if you're watching on Twitch, you're kind of getting the side view over here of me. So she came over here because she didn't want to see the side view. Because if I'm talking here, it kind of looks rude over there. Because I'm over there. So this is Anne. I wanted to show you a Twitch message. Well, thank you for that. A Twitch only stream today, or is YouTube being stupid? YouTube's being stupid. YouTube definitely down today. Sorry about that, you guys. But thank you for watching on Twitch. Feel free to engage in the content here on Twitch. I will come to you guys. And Prog Queen is laughing at me over here. You like me looking at you in the eye, and I've trained myself to look right at the camera right there. So it does look like I'm looking right at you. So, all right. Thank you, Twitch. Let's pop over here now to the Facebook page. What's up, Facebook? I'm looking right at you guys now. See what you guys have to say. Hi, Jimmy. Get out and enjoy some sunshine. Great medicine and free. Oh, candy. I get that all the time. For sure. That's my jam. When I'm not Jimmy Ranson, I'm getting all of that. Informed people recognize a chemical crap storm when they see it. Yeah, and don't want the side effects. PEG, candy, is the name of that ingredient. So polyethyl glycol. Yes, you got it. They need better transparency with certain groups. They do, like over-the-top transparencies. Dr. Asia Muhammad, yep, that's her name. Go look her up over on Instagram. She was the one that called out, we're not taking this thing. Don't blame them at all. Disgusting and vile. Yes. I wonder how many of the people that took the first shot will reject the rest of the shots. Is that possible that they can? I don't know. I would assume if you got the first shot, the second one's voluntarily done. But if you already got the first shot and you seemed okay, why would you not take the second one? The only time they've said don't take the second one is when someone had an adverse reaction after the first one. But the problem is sometimes these adverse reactions can take a little while to develop. So they get the first shot 3 weeks later, 4 weeks later, 3 weeks for Pfizer, 4 for Moderna. And then they get the second shot, and then they get an exacerbation of whatever side effects they would have gotten. So, yeah, I ain't going to be the guinea pig. Not me. Candy says it won't prevent the spread. I hate that people personally know or think once they get the V word, then they will allow family to visit them, and we'll be back to normal with everything, some of them are already dealing with dementia and metabolic issues. Yeah. Normal's gone, guys. I hate to break it to you, but I don't see, until we get out of the hysteria of all of the histrionics of this 9/1 DIVOC pandemic, I don't know how we're going to get back to any semblance of what normal was. And it's tragic, the people that have gotten this and had some effects. But most of the people I know who have gotten this, and they're relatively healthy people, even people that had a high viral load of this. I think about Metabolic Mike Muscle over here on Instagram. He got it. He lost taste and smell. And he's had a little bit of elevated blood pressure post, but he said the actual dealing with it just felt like a really bad cold for a couple of days. That was it. And he's healthy, and he survived it without a V word. And they're also telling him now, oh, you still have to take the V word. He's like, why? I've got antibodies in my system. Why? It doesn't make any sense. All right, let's look over at YouTube. I know it's dead now, but let's see what came in. Anne says she's currently recovering from 9/1 DIVOC. What a Christmas present. Yikes. And also said, don't want the V word. Didn't want it before. Certainly don't want it now. What if it's a different strand than what I had? Yeah, that's the other thing. And thank you for that, Anne. The other thing is we supposedly have this new strain. And we're going to have bunches of new strains. And quite frankly, 1/2 DIVOC might be coming. So then what? Do we get a shot for that one as well? Like, are we just going to just shoot ourselves to death with every coronavirus known to mankind that continues for the rest of our lives? Why have we never gotten a shot rushed before 9/1 DIVOC? What makes this one so different from all these other ones that have been out there in the history of mankind? Why this one? We're setting a bad precedent, if you ask me. I already have 3 autoimmune issues and am recovering from metabolic syndrome and type 2 diabetes. Yeah, so that's the concern, Ann. You take the 9/1 DIVOC V word and the PEG, that ingredient in there, that's what's going to exacerbate your autoimmune disease and make it worse. All right. Thank you, YouTube, and I apologize those of you that popped over to one of the other formats. YouTube did have a hiccup, and it just ended the stream. It did spin for a while, and then it just suddenly ended. So I apologize if you were watching over there and it got stuck, but this is why I do multiple formats, you guys. Joshua says, we will be chasing the mutations of this thing forever. Yes, and that's what makes this rushing of a V word so crazy to me. Why rush a V word for one version of a strain when the strain is going to continually change? Are we going to just add 9/1 DIVOC to the annual seasonal flu V word? But then now this is going to be mandatory because this is worse than the seasonal flu? Like, can you see all the questions at play here? We're going to be chasing this thing forever. And I think, again, we are setting a very bad precedent for any future coronavirus. Oh, look what we got the idiots to do with 9/1 DIVOC. Let's get them to dance around again in masks and socially distance and not see grandma. Oh, grandma died in the nursing home. Don't go to Thanksgiving and Christmas. Just stop living your normal lives, you freaks. I don't like it. I don't like where it's headed. And this is where I think we're reaching this point. Maybe I should do a whole Jimmy Rants just on this. What happens when enough people say enough is enough is enough, and they rise up against all of these measures? Because never have we had to go through all the things we've gone through with 9/1 DIVOC. We haven't. And so what do they do if enough people buck up against them? What can they do? What will they do? I don't know that they could stop people that are bucking. And there's people, individuals now, and groups and pockets of people now, but what if over half the population says, I ain't wearing a damn mask anymore? What if half the population says, I'm opening my business, I don't care what you say? Because we're getting to that point where people are like, okay, I don't see a vision forward. I really don't. Low Carb New Yorker says it's like the flu shot cocktail. Yeah. They'll add 9-1 DIVOC. They always add stuff to it anyway. Dao Zhu said, keep the population uneducated to keep better control of them. And sadly, I was watching a George Carlin stand-up over the weekend when I was just chilling out over the weekend. And man, what a soothsayer that man was as a comic. If you've never watched George Carlin, go look up some clips on YouTube. Go find him on one of the many ways that you can access content now. He was so on it. He's like, they don't care a bit in the world about you. It ain't about you. It's about them. And they're going to do whatever they can to control you, make you stupider, make you fatter, make you unhealthier, so they can just rip your nuts off anytime they want. He was so right. Like, I love his comedy. I think when I was younger, I didn't appreciate how stark he was being. But he's great. He's really great. Are they just trying to scare people more with the new strain or setting people up for more V words? I think it's both, Candy. I think it is a scare tactic because people are not as scared, because quite frankly, not as many people are dying from 9-1 DIVOC now, despite these news articles saying, oh, it's increasing. No, it's not. It's actually the death rate has gone way down compared to what it was in the spring last year. So, yeah, scare tactic for sure. I have people argue that we've been getting polio shots, rubella, smallpox, V words for centuries. Why wouldn't you trust this new one? You survived. I got one of those today on my Instagram page. A lady said the same thing. And I told her back, yeah, because this one was the fastest one in all of human history. They did not do the proper clinical trials. It's also the very first mRNA V word, which has never been thrust on a human population before. In all the animal trials, they do very poorly with mRNA V words. That's why they've never really come on the market. It also contains that PEG, which is a known toxin that could lead to autoimmune disease, anaphylactic shock, and death. Like lots and lots and lots of reasons why this one is far different from all those other ones. I don't think we can actually sustain the level of fear they want us to feel for much longer. No, Joshua, I agree with you. I think people are at their breaking point. I think they were hoping that by year's end of 2020, that some of this would start to ease up and 2021 look better. I guess it depends on what happens, at least here in America, with what administration is in there, because it is still very up in the air. It's pretty sure to be one thing, but it's possible it could be another thing. So all of that also will play a role in this about who's leading. So stay tuned, guys. Stay tuned. But hopefully now you understand a little bit better, because you're not hearing about this much in the mainstream of the media. Why Black people, why healthcare workers, they're not really running towards this V word for 9-1 DIVOC. They're running highly away from it. Marcella says, I got my V word this morning. For 9-1 DIVOC, is that the V word you got? That will be interesting. And which one did you get? Did you get the Pfizer or the Moderna one? I'd be very interested. But guys, that's it for this episode of Jimmy Rants. JimmyRants.com is the website. And as always, you can engage live in the content. Come follow me right here on the Jimmy Rants feed over on Instagram. We do go live on Instagram Live at 11 a.m. Eastern Time, Monday through Friday. So thank you so much for being here. We also simulcast live over on Twitch, over on Facebook, and over on YouTube. Again, sorry, I lost the YouTube feed. I don't know what happened. If you missed the live, you can watch it on replay. Pop on over to the IGTV at the Jimmy Rants Instagram page. You can also watch the past episodes up over on Twitch. It does save it there for you to watch on the replay as well. And then over on the YouTube, just type in a keyword Jimmy Rants. You'll find the show, and you can see the latest episodes of Jimmy Rants. While you're there, by the way, click on the subscribe button, and then click on the bell to get all. And when I go live, you'll get a notification that lets you know I went live. And then finally, pop on over to JimmyRants.com. That's the official website for this here show. And you can see all the past episodes there. Marcella says, yeah, I got the Pfizer one. So you got the first shot of Pfizer today. So the second one will be in 3 weeks. Well, I wish you well with that one. You're one of the mRNA guinea pigs, and I hope everything works out for you. All right, guys, that's it for now. Coming in tomorrow, I have a wonderful time about talking about 9-1 DIVOC again. And this is an article that was written by my friend Doctoring Keto here on Instagram. If you're not following Kristen Bear, she's a medical doctor who practices low-carb, ketogenic medicine with her patients. And she's in San Diego at a metabolic clinic called Low Carb MD San Diego. And she wrote this article, Metabolic Health in the Time of 9-1 DIVOC. So that'll be fun to read that one to you tomorrow. Very insightful comments that she has about this pandemic we're in, and how basically your metabolic health is everything when it comes to this. So thank you so much for watching today, and we'll see you again tomorrow at 11 a.m. Bye.